Started. Welcome everyone to this webinar about workforce trauma in the homelessness sector. It's great to have you with us. My name's Kate Colvin. I'm the CEO of Homelessness Australia, which is the national peak body for the homelessness sector. I'd like to begin by acknowledging that we're having this conversation on the many unceded Aboriginal lands across the country. I'm joining from Wurundjeri country. I'd like to pay respect to elders past, present and emerging and acknowledge any First Nations people joining the conversation today. So we're joined by our fabulous panel. So we're going to, I'll introduce everybody and then we're going to hear from Deb, who's going to explain the findings of the research to us. So first of all, we have Deb Batterham, who's the lead researcher for the Ahuri research project, Workforce Trauma on the Social Housing and Homelessness Frontline. And then we have Stephen Hawkins, who's the Head of Strategy and Systems at Homelessness Queensland. We have Dom Rowe, who's the CEO at Homelessness New South Wales, and Deb DiNatale, who's the CEO at Council of Homeless Persons. So how this is going to work is that we're going to hear from Deb about the research, and then we're going to have a panel discussion amongst all of these fabulous peak bodies to explore the research and hear more from Deb and really explore what the research is telling us, but also what the solutions are. So without further ado, I'm going to ask Deb to kick off and tell us what the research is telling us about the homelessness sector.
Great, thanks, Kate. I'll just get everything up there. Can everyone see that okay?
Yes, that looks good.
Great. Okay. Thanks, Kate. Thanks, everyone, for coming along. So I'm Deb Batterham. I'm a research fellow from the House Group at Swinburne University. And I also previously worked in the SHS sector in a research and evaluation role for around 2 decades. I feel privileged to have worked with so many incredible frontline workers, and I hope that by bringing some of their or your experiences into the light, this research can help to make workplaces safer for workers and also for the people that they support. So as Kate mentioned, these findings come from an Ahuri report that was recently released, and the research team included Emma Barnes, Chris Hartley, Kathleen Flanagan, Catherine Robinson, Perrette Viroa and Jess McElprang, as well as myself. I'd like to acknowledge that I'm joining today from the lands of the Wurundjeri Willam people of the Kulin Nation in Naarm, and pay my respects to elders past, present and emerging, and any First Nations people in the room today. I'd also like to acknowledge any people in the room today with lived experience of homelessness, as well as those working on the front line, because the challenges that you both face are very much interconnected. So I'd also like to thank our incredible participants who so generously shared their experiences and insights with us. Without them, we wouldn't have been able to do this work, so big thanks. And just noting that this presentation does come with a trigger warning. Some of the material may be distressing to some people. So in the research, we use the term workplace trauma to refer to direct or indirect exposure to traumatic events, situations or information that people experience as a result of their work, as well as the consequences of that exposure. Now, the exposure could be a one-off event, but most likely it's a series of events that occur repeatedly on a regular basis that have a cumulative impact. I want to cover 4 main things in this summary today. Firstly, what it's like on the front line and the multiple and intersecting sources of harm. And I think it's important to give this a little bit of space because trauma exposure is heavily normalised in the sector. And as we'll see, it's causing cumulative harm. I want to describe the impacts on workers and how those impacts flow through to organisations and the sector as a whole. I want to touch on current practices in the sector and their limitations, and share with everyone the important part, which is the solutions about what our participants said needed to be done to make their work safer, and talk a little bit about how we might do that. So these findings are from a larger report, and what I've done for today is just do a cut of the data just focused on SHS. Our bigger report covered community housing and state and territory housing authorities as well. So the data for today includes information from 8 stakeholder interviews. We had 376 SH staff participate in our national survey. And we have 9 sort of in-depth interviews with frontline staff in 3 states. So, a range of things are causing harm to frontline workers, and I'm going to work my way down through this list. Firstly, trauma is woven into the day-to-day work of frontline workers through the challenges of supporting marginalised people. So this figure is a selection of negative events and experiences that workers can have when they're working with people experiencing homelessness, and I've used clients in the figure for brevity. So the red bars reflect the percent of participants, this is from our survey, who experience these things directly, witnessed them, or had them happen in their workplace. So almost universally, workers were hearing details of traumatic experiences, including abuse and torture, talking about suicidal ideation and doing suicide risk assessments, and also dealing with people who are substance affected. Most also experienced threats to harm or kill them or their families. 84% of frontline workers have been concerned for their physical safety at work. 59% have experience of physical assault in their workplace, and 29 reported experiences of sexual violence from a client or tenant. 74% have had a client die in their workplace. Slightly more, 78% have had someone attempt or complete suicide. And overdose, family violence, child abuse and neglect were also commonly encountered. And there's a much longer list of things in the report. So these statistics reflect the traumas that people experiencing homelessness are grappling with and are linked to the increasing complexity of trauma and the needs this group experience. As one worker explained, 30 or 40 years ago, we didn't have the level of client complexity that we do today. Now we're working with clients who have severe mental health issues, serious drug and alcohol problems, legal issues, and involvement with child protection. Exposure to negative events and experiences is routine in this work, and depending on the service, critical incidents could occur weekly or even daily, as one worker shared here. Now, this worker was responsible for the duress alarms at their organisation and shared with us that all the duress alarms came specifically to their work phone. And once they were on outreach themselves, and they needed to press the alarm and their own work phone buzzed, and it was unclear in that moment whether anyone else knew that they needed help. So it's not just that these negative events and experiences are common, it's that because of a lack of resources, in particular housing options, workers are also struggling to provide meaningful help and feel morally compromised by what they can offer and the decisions they have to make. They bear witness to immense suffering and despair and experience that despair themselves. As one participant said, you hear the stories and you have such rapport for them that when the world kicks them in the arse, you just go, fuck, really? How much more can one person take? Because resources are thin on the ground, services set mutual obligation and eligibility criteria to ration the services that they offer. But because of these rules, sometimes workers have to turn people away, or have people they are supporting turned away from other parts of the system. One worker explained the circumstances in which one family were denied crisis or temporary accommodation. So there was a young family with a child who has a disability. They weren't given crisis or temporary accommodation because they hadn't looked at enough rental properties within their affordability range. But the reality was they couldn't find enough options they could actually afford. They were told they hadn't met their obligations, and so they were left with no choice but to sleep rough for the weekend. I think it's quite clear in this example that such decisions harm both workers and the people who come to them for help. So moving on now to issues within organisations and across the sector. So these experiences occur in the context of overwork, consistently not being able to meet demand and not having enough hours in the day to get the work done. One worker explained that staff vacancies can go unfilled for months, while another explained we could have 10 more staff and we'd still be struggling, but it would make a huge difference. We've got a waiting list now with each worker carrying around 25 clients. We've got around 80 unallocated clients. That's 80 men waiting for a caseworker, and all of them are homeless. Insecure funding was an issue that was identified by both frontline workers and the stakeholders that we interviewed. It adds unnecessary pressure to jobs that are already under-resourced with high trauma exposure. As one stakeholder commented, I'm often only finding out whether we need to move people into new roles weeks before the end of funding. You have people coming to talk to you about, well, what's happening with my job? And you're like, well, I actually genuinely don't know the answer to that. Organisational issues as well, including general psychosocial hazards, further compound harm. So issues such as lack of or poor supervision, bullying and harassment, poorly managed organisational change, and isolated work for after-hours workers and outreach or outpost workers. So systemic issues impact on the day-to-day work of the sector and are also contributing to workplace stress. On this point, some researchers in Canada who are investigating homelessness services over there have coined the term systems trauma, which speaks to the idea that the same structural factors that create homelessness or prevent its resolution also flow through to workers and services and cause them harm. So we developed a series of statements based on their work to reflect systems trauma in the Australian context, and we asked participants how much they agreed that these were issues, which were an overwhelming majority, and then we asked how much stress they experienced from 7 system-level challenges, and the majority of workers rated each of these options as causing significant stress. So they included not being able to do more for their clients, complex referral processes and eligibility, criteria across service systems, inadequate responses from other service systems like mental health, AOD and child protection, insufficient funding, income support payments being too low, lack of safe and appropriate crisis accommodation, and lack of affordable rental housing. We heard reflections from multiple participants, both in our interviews and in the surveys, that homelessness services are very much services of last resort and are being asked to carry the load of both the housing crisis and lack of funding across the entire social care system. So workers in both the survey and interviews identified a range of negative physical, emotional and mental health impacts from their work. This included physical symptoms of stress, compassion fatigue, moral injury, emotional distress, and symptoms of trauma such as fear and hypervigilance. In our survey, we included 3 validated tools to screen for symptoms of post-traumatic stress disorder or PTSD, vicarious trauma and burnout. And this figure shows the results of these tools just for SHS workers. So we found that 42% of SHS workers in our survey screened positive for PTSD symptoms. Now, we can't diagnose people with a screening tool, but results are highly indicative and suggest that about 42% of our participants need to follow up with a psychologist for an assessment. Nearly half of participants, 46%, scored high for vicarious trauma, and a further 45% scored moderately, suggesting widespread vicarious trauma in the workforce. And 62% of workers reported 1 or more symptoms of burnout. So the impacts on individual workers flow through to the rest of their team, to their work with people experiencing homelessness, and to organisations and the sector. So service delivery is impacted by either desensitisation to people's trauma or increased reactivity, and we heard examples of both in our results. Injured staff taking leave also mean that other workers take on increased workloads, which increase their risks of harm and makes it difficult to provide a service to people experiencing homelessness. And organisations are impacted through high staff turnover and increased staffing costs. So there's significant and widespread harm to the workforce, and it's impacting the sector as a whole. A range of practices are currently in place, but widespread harm is still occurring. Most organisations have formal systems and structures, including incident reporting processes, employee assistance programs, and workplace policies around critical incidents, managing high-risk situations, and safety. However, what we see very clearly in our results is a disconnect between what exists on paper and how it's experienced by workers. So many frontline workers described incident reporting systems as burdensome and rarely leading to meaningful follow-up or change. Similarly, EAPs, or employee assistance programs, while widely available, were often described as impersonal or a tick box response, where responsibility for trauma is shifted onto the individual rather than addressed systemically in the workplace. In terms of support, supervision is widely present but often lacks trauma-informed depth. Less than half of workers in our survey reported supervision that actually helped them understand their stress responses or the emotional impacts of the work. And importantly, most support systems are oriented towards critical incidents rather than the cumulative everyday exposure to trauma that workers experience. And current practices are also limited by broader system constraints, including time pressure, staffing shortages, and high workloads. And these limit the ability to engage in training, supervision, or reflection. And we also found across both the survey and our interviews that there's a strong culture of normalising trauma as being just part of the job. So, what can we do to fix this? Our participants provided us with a whole range of suggestions for what they needed to make their work safer, and we've summarised these into an agenda for change. In the occupational health and safety space, we have the hierarchy of controls, which arranges actions or hazard controls in order of the greatest impact in preventing or reducing harm. The actions with the greatest impact sit at the top, which you can see in blue here, whereas those with the least sit at the bottom. So I'm going to start at the bottom and work my way up. So in terms of improved supports for staff to manage exposure, we could centrally provide EAPs, ensuring expertise in homelessness work, capacity for ongoing support from the same counsellor, and longer periods of support. We could also resource peer support networks for frontline workers and acknowledge that it's really peer-to-peer relationships at the moment that are keeping the wheels on in the system. In terms of changes to organisations, policies, procedures and practices, we need to embed clinical supervision and reflective practice, improve effectiveness and timeliness of critical incident management, as well as building in mandated time off after critical incidents and engaging in critical incident reviews. Participants wanted to see expanded training programs to improve timely access to training and also space within their work to embed the learnings from that training. We also need to see a focus specifically on the safety and wellbeing of casual and after-hours staff because they're at increased risk of a range of harms because of their isolated work. In terms of physical changes to workplaces, we need to implement trauma-informed design principles in the architectural and interior design of services and improve dedicated safety equipment such as duress alarms and CCTV. I probably don't need to say that it's not appropriate to have all the duress alarms go to one worker's phone only. In terms of reducing exposure, we've broken this down into improved work design and improved conditions. So in terms of improved work design, we need to see increased staffing levels, including backfill. So we had 65% of our participants disagreed that their workplace was adequately staffed. We need smaller case or tenant loads with guardrails to prevent overwork. And again, 58% disagreed that their team had reasonable staff to client ratios. We need to mandate a 2-worker model for outreach work. We need to support job rotation to give people a break from the front line. We need to improve role clarity for workers. So workers shouldn't be constantly doing work outside of their roles, and their position descriptions should be specific. And people also wanted to see dedicated time for admin and decompression built into their daily work routines. In terms of improved conditions, people wanted to see improved leave options. They wanted to see flexible working embedded in their work, increased skill for managers in supervision and reflective practice, but also in health and safety awareness, and improved pay to retain skilled staff and help address staff shortages. And in terms of reducing the risk, I feel like we're all going to be in the room here in fierce agreement about these. We need to reduce overall staff and client distress by increasing the supply of both social housing and crisis accommodation. We need to increase social work support for tenants in social housing so that they don't re-enter homelessness. We need to increase the accountability and responsiveness of allied service sectors such as mental health, AOD, family violence, child protection and justice for responding to people experiencing homelessness or living in social housing. And we need to enhance collaboration and information sharing between homelessness and allied service sectors to support timely intervention and reduce trauma to clients. Now, that's a pretty big wish list, and significant additional funding is needed to make these changes, but doing so will reduce the harm to workers and it will improve services for people experiencing homelessness as well. How am I going for time, Kate? Oh, you're on mute.
I think you're going well. So just, yeah, keep going
Right.
well.
Okay. I'll spend some time going through this slide a little bit as well. So in our report, we discussed a number of levers for making some of these changes, and I've summarised them here in a kind of to-do list based on some of the thinking in our report, taking it a step further about who can do what and what we can do. So a key principle in health and safety is that the workers who do the work have the best understanding of safety issues, of what will make their work safer, and what's feasible on the ground in practical terms. So as employers, peak bodies and unions work towards these changes, frontline workers need to be at the centre and intimately involved in any changes to their day-to-day work. So I've put them in the middle there. In terms of industrial change, which is probably needs to be led by unions, we need to look at improving award conditions. So rates of pay, leave entitlements and flexibility can sit in there. And it will also support workers who are on enterprise agreements because lifting the award lifts the floor for all workers. Improved job design, so things like role clarity, recognition of skills and time for admin is a job design piece, and unions can support and play a role there. And obviously advocacy and campaigning. What governments need to do, there's a long list here. Changes to service commissioning and service guidelines. So that's the place that we can really start to see some guardrails around work design, client loads, staffing levels and backfill. We need government to provide funding to support this work. This is not cost neutral. This requires significant additional funding, and a key finding in our research was actually that the lack of funding was part of what was causing some of these problems as well. Mandating and resourcing cross-sector collaboration and information sharing across sectors, something the government can do. Accountability for allied sectors as well in supporting people experiencing homelessness and those in social housing, and increasing the supply of social housing and crisis accommodation. In terms of what the sector as a whole can do through our peaks, sharing information about what different employers are doing and examples of best practice, expanded training, and also advocacy. They play an important coordination role, so it's wonderful to have all the peaks in the room today. And in terms of individual employers, they can be looking at their OH&S obligations and how they are responding to psychosocial hazards. They are very much involved in job design as well. In terms of policies and procedures, they could be looking at including critical incident debriefing in their policies, updates to supervision and reflective practice, position descriptions. That is very much where employers can do a lot of work as well, making them much more specific, and job rotation, especially in large employers. giving people breaks from the front line and enabling them to step back. So I'll wrap up now and say that, I suppose in summary, that workers' health and safety is inextricably linked to their conditions, to the design of their jobs, to the way that organisations operate, and the systemic context in which homelessness occurs and services are funded and delivered. So urgent change is needed and necessary. You can read the full report, which covers also community housing and state and territory housing authorities. And I've put here two different resources that look at supports for controlling psychosocial hazards in general and also in the community sector. So there's some great resources there for employers to have a look at. I will stop sharing now and wrap it up there.
Thanks so much, Deb. It's I think one of the things that's really fantastic about the work, and thank you so much for, all of the work that went into actually doing the research and also just sharing today. But it is really fantastic to have those really important insights from the sector and from the workforce, but coupled with that really useful framework for what needs to happen. So what I want to do now is switch to our panel. So sorry, hang on a sec. I just have to adjust how, so everyone's spotlighted on you. There we go, Deb. Stop spotlighting on Deb. And I hope everyone can see the whole panel. So what I want to do now is go to our panel and ask you, so maybe Dom, if I start with you, ask you about whether or not the findings in the AHU research are consistent with what you're seeing in other research that perhaps has been done by Homelessness New South Wales or in New South Wales.
Yeah, I think this research is absolutely amazing, Deb. So congratulations on completing it. I think it really pulls together nationally what's happening across the homelessness sector. And we're definitely experiencing it here in New South Wales. Those figures around burnout and PTSD really resonate very, very strongly. And we're hearing that now workers, instead of moving from service to service, are actually leaving the sector entirely because the stress has become too overwhelming. And so the results of your research are really interesting to see and just reinforce that particular challenge that we're having. I think there's lots of challenges, sort of lots of provocations that you put in the research that you've done, which I really want to commend you for, because I think we need to constantly be ambitious in this space. And sometimes it's very easy to feel beaten down and that things aren't possible, that solutions aren't possible. But you've been quite practical in some of the solutions you sort of presented. There's a few things that we're looking at in New South Wales to try and respond to this research and what we're also hearing from our members on the front line. The first of those is we're actually doing a wellbeing survey, looking at some of the factors that are contributing to trauma in the workplace and looking at some of the things that employers are putting in place to try and manage that risk that's happening every day at an increasing level. Also, for those of you in New South Wales, we offer a range of learning and development opportunities, some of which focus on how to work with people who are experiencing trauma, how to use emotional regulation, how to build resilience. And it's not all about resilience. These are pretty tough circumstances we're in, but it does help a lot. And how can we better support health and wellbeing at workplaces in New South Wales? So we're doing those things for the moment. I might talk about some of the more systemic things later in the chat, Kate, if that's all right.
Beautiful. Thanks, Dom. Stephen, can I pass over to you to understand how this is consistent with other research you've done in Queensland?
Yeah, thanks, Deb and Kate, and thanks, Deb, for the research. And before we start, just to acknowledge the Yagara and Terrible people from where I'm linking in from today in Brisbane. Look, yeah, as Dom said, the research really does articulate well what we're seeing here in Queensland. Queensland has such a spread as well, such a geographical and culturally diverse landscape, both workforce and also those seeking supports. And really just feeding into that research, what we're really seeing here in Queensland is, and I've listed 3 stressors, if you like. From an engineering perspective, from a systems perspective, we all know and probably now are very much, I guess, reliant on a crisis and outputs driven service system. We use the word resilient, and to me, resilient is something that we call upon every now and then. But effectively, we have a workforce that gets up every morning and is having to rely on resilience in working with people that are constantly in crisis. Service users in crisis equals a workforce in crisis. So a very programmatic, very siloed service system that's actually invoking work-related distress for our workforce. There's really one stressor. From an organisational or a funding, and it's great, it really does talk to Deb's final slide in the recommendations. In Queensland, and I'm sure this is reflected in other jurisdictions, we currently have very short-term funding. So from a funding perspective, we have people, and we're now in the fourth quarter of this financial period. And I checked in this morning just to make sure that what I was saying was correct, but we have a large cohort of SHS services that are yet to know what happens from July the 1st. Then that's disseminated down into the workforce with regards to uncertainty. So at that in organisational and funding climate level, we're also imparting trauma-invoking thoughts in a workforce that really doesn't know whether or not that they have work beyond June 30th. Now, just in referring back to some research that Homelessness Queensland did during 2024 and 2025, we went around the states. We talked to over 400 Queensland-based services, representatives of services, I should say. Amongst a series of inquiries that we were looking, one of them was, what is your support system, your organisational and external support systems like? And over 30% of respondents stated that there were no formal supervision framework. So we talk about trauma-informed supervision, we talk about culturally informed supervision. 30% of the people that responded to the survey cited no formal supervision whatsoever. 2 other findings that really as well alongside that inquiry that were raised some concerns was that supervision was blurred. It became a very blurred conversation. It wasn't delineated and treated as its own separate mechanism. It was in fact morphed into operational performance or case review conversations. So there was some blurred boundaries about even what supervision actually was. And the final one with regards to that is the supervisory process was something that, as we all know, very busy sector. Supervision was one of the first cabs off the rank to be cancelled, both upward and downward. So supervisee and supervisor, it would be very easy to cancel. What we didn't statistically test this, but anecdotally, just through the conversations we had and some low-level descriptive statistics, is we were finding there was a correlation with the larger orgs or organisations that had some relationship with local universities or allied health services, but the rest had no external supervision outlet. So we were having conversations that were saying, hey, there are no formal internal supervisory processes, but also as well for the smaller organisations, there was no external supervision as well. So quite an exposed workforce. I'll come to the system stuff like Dom a little later on if you like, Kate.
Beautiful. Thanks, Stephen. And Deb, can I pass to you to hear from what the experience has been in Victoria?
Yeah, before I start, I just want to acknowledge that I'm meeting you all on Wurundjeri country and pay my respects to elders past and present. And I also want to just a shout out to Deb and your team for this excellent research and bringing it together, because I know how long it can take. Victoria is having almost exactly the experiences that we've already heard from New South Wales and Queensland. One of the biggest issues that has been highlighted has been the occupational violence. So that's one of the things where we've really tried to address that in Victoria. And all of the things that are impacting on staff that we're hearing from our members is the idea of we're in a similar boat to exactly those findings, that people are on short-term contracts and they've got high workloads. I think one of the tagline issues that I often use is the report that we did a couple of years back, which was the largest and broadest we had done on specialist homelessness services, which demonstrated that we're losing $20 million every year on staff turnover. Now, that's a huge number that we were hoping government would really turn its mind to. And if you ask how did we get that formula was on government's own website around how they assess what the cost is of staff turnover. So retention's a massive issue. What we also found is that before we would have people that were leaving homelessness in one area and going to another. Now they're leaving the sector altogether and moving across and not coming back. So we haven't got that return that we used to have. And all the things that we heard before around, we know what the problems are, but what are the solutions? It's really hard to get obviously more money. We continually advocate for more resources, but and this we acknowledge is much easier in larger organisations than smaller ones, but regular access to quality supervision was a really big and consistent theme that came up in the findings, was that they wanted high quality, regular supervision and individual, because some of the organisations had taken to doing team supervision, which the findings were that they weren't really as useful as the individual ones. And just the difference, which sounds really small, but that appropriate induction and onboarding can make to somebody's ability to be able to transition properly into that organisation, and the opportunity for professional development. We hear it all the time, but with that level of turnover, it's really hard to keep your eye on recruits and ensuring that they're getting really good supervision. And clearly defined career progression pathways is another big piece that came up in that large research that we did. I think we've got to continue to advocate to government to ensure that all of these things sound fantastic, but when you're an organisation that is at capacity, it's very hard to implement any of these measures without the extra resources.
Thanks, Deb. What we've got a really fantastic conversation going in the chat. So I think one of the things that's come through really clearly in those contributions is this question around supervision, both internal supervision and opportunities to have external supervision. So I'm wondering if people might like to share their reflections about what they're experiencing around access to supervision or provision of supervision. You might be someone that provides supervision in the chat, and what you would find, more useful perhaps than what is currently happening. And then while we're, gathering that information in the chat, I'd really like to start us talking about some of these system changes, because the other thing that's coming through very, very clearly through what everyone's saying is that a lot of this pressure on the homelessness system is as a consequence of system pressures that sit outside the homelessness system, that more and more people are being pushed into homelessness, that we don't have access to the housing for people to have a pathway out of homelessness, that people lack the supports that they need, either access to supports within the homelessness system or access to the supports they need outside of the homelessness system in mental health and other systems. And that's often why they're coming into homelessness. And then, of course, that adds to the pressures within homelessness. So just thinking of those system pressures, Dom, can I go back to you to reflect on what you think needs to change in homelessness systems to address this issue of workforce trauma.
Yeah, I think I might just start with the simplest one first, although some may laugh on the call about what is the simplest and what's not. But one of those things is bringing the various systems into connection with one another. And I think we're starting to see across Australia in a range of places, local collaboration starting to take place. Some with many mistakes being made, some with fewer mistakes being made, but at least starting to get together mental health, drug and alcohol, social housing and homelessness services together so that we can collectively problem solve, because I think all of us know on this call that we are stronger together when we do that, and our clients really benefit from that strong collaboration and work that homelessness services workers are incredibly skilled at doing. It's one of the key skill sets actually of homelessness service workers that I think we need to recognise better than what we do in our current award structures, for example. But the other thing that I think we need to do is I went around New South Wales and I asked every single person I came into contact with if there was one thing you would change about the homelessness service system so that we could improve homelessness and give everyone a place to call home. People said to me, firstly, that we need more social housing, and that's an incredible ingredient in the system. And that requires a systemic response and a response from all of those sectors that I mentioned before, but also from homelessness services. I think we've got to all be putting our sort of shoulder to the till on that one, because again, together we're stronger. If we just rely on peaks to do all of the arguing for social housing, we're not going to get the massive investment that people really need in a really strong, solid social welfare base. The second thing I'd say is that what people were saying to me is that we needed more homelessness service funding. And you can really see that in Deb's report that she's put out, that there's a number of things that homelessness services would love to be doing, but they are just funded on the smell of an oily rag. The sort of real challenges that are presented by people facing homelessness, the real challenges getting back on a housing pathway are just not properly recognised by our political leaders, and something that needs to change. So here in New South Wales, we're running a campaign, It's a Place to Call Home, and the support to keep it, asking for two things. One's a 50% increase in homelessness service funding, and the second is moving to 1 in 10 social homes being social homes, so that people can actually have that place to call home and have it as a human right rather than a privilege, which unfortunately we find that too often today. So I think if we address those two things, then we would find a lot of the risks could be better managed than what they are today.
Beautiful. Thanks, Dom. And if you can share the link to A Place Called Home in the chat, that would be super useful. Stephen, can I go back to you to talk about your view from Queensland about what those system changes need to be?
Yeah, thank you. Following on from Dom, yeah, look, let's acknowledge the work that people get up every morning to do. They do a phenomenal job against a backdrop which is extremely challenging on the best of days. So really, I just want to share two systemic changes. One of them feeds into Deb, Dom, and Deb's commentary already. There's an educative piece that needs to happen. Funders need to understand that providing support to a workforce is mandatory. It is not the warm and fuzzy. It is not an add-on, a bolt-on, a nice to have. It is absolutely mandatory. We talk about, and Deb raised this, two up going out on outreach. That's fine. You know, that should have taken place many, many years ago. We also need to educate. We actually need to educate funders, government agencies, whether they're state or federal, in the fact that to deliver meaningful services, one, we need an outcomes related framework that doesn't just look about the outcomes that the service sector achieves for people seeking assistance. We also actually need framework that actually plots the health of the workforce. So we need to understand more the challenge. What is trauma? The high level question in the homelessness workforce. We need to understand it more to then further educate those that will ultimately be seen to actually requiring to provide additional funding. Rather than saying here's funding for 7 people because your outputs are linked to the delivery and the of seven workers, the funding package needs to also it needs to include a support package as well to keep those workers healthy. So there's one systemic change that I would see is really important. Now, on the back of that, the second one in Queensland, Homelessness Queensland has recently, in collaboration with what was now known as the Critical Friends Group, we've established the Pivot Movement Queensland. What I mentioned at the start of my first piece was we're currently exposing the workforce to crisis. Every day they're getting up and they're responding to crisis. And what Pivot is looking to do, guided by the Critical Friends Group, but in time, in broadening our consultation with the broader service system, is to actually develop the Queensland Early Intervention and Prevention Roadmap. We genuinely believe, in addition to moving upstream, where we see through pilots, through hard evidence, great outcomes for specific cohorts when we respond earlier, there are also benefits for the workforce in becoming more proactive, more paced, more considered in responding to an issue that hasn't got to crisis. So I'll put the email in the chat with anyone that wants to reach out. Yes, it's Queensland, but we're interested in any thoughts, feedback, and supporters from further afield. But what we're wanting to do is put a roadmap in front of government and say, hey, look, we want to go on this journey. We need to transform the service system. Too long has it been crisis and outputs driven. We need to move towards an early intervention, prevention, and importantly, an outcomes focused service system. Thanks, Kate.
Thanks, Stephen. Fabulous. I think, do you want to put a link to the information about the Pivot Movement, because it's super exciting, encourage people to participate. Deb, over to you. Deb Di Natale. Deb.
Thank you. I was waiting for the right Deb. So there's 2 of us on the line today. So when we did our consults with our workforce, we just got 3 basic questions that kept coming up. One of them is, can you build us more houses? The other one is, can you get us more staff and more pay? So I think that's a really clear summary about what the workers are needing. Rural and regional Victoria was obviously it's more heightened there because of the difficulties about being able to recruit staff. And the other pieces that we often think about is the approach that we're taking. We're doing some advocacy around the SHADS Award review. That is, they're looking at more cuts to the higher pay scales for the homelessness sector support workers. So we're doing an advocacy piece with VCOS around that. And one of the other things that we ask for here in Victoria is saying we actually need to have, in lots of ways, sorry, that's my phone that's a bit unhelpfully going now. We need to have a better system about asking for a cross-sector support with working with AOD, with mental health, and with homelessness support. And that might get us some more traction around getting our workforce the support needs that we're after.
Beautiful. Thanks, Deb. Can I ask people, can I go back to you, Deb Batterham? And I was hoping you can share the slide with all of the solutions in it. And I'm really keen for everyone in the audience to comment on what they see as the priorities in these forward strategies to address workforce trauma. So where do you think, if you want to make comment in the chat about which strategies you think will be most effective and are most important, and you're welcome to also contribute if you think you know, if you could see some strategies there that you think, well, I don't think that will really make much difference. Just interested in all of that feedback. Certainly from my perspective at Homelessness Australia, I think the overall system level change is what I would see as the most important. I think we're just in a completely untenable situation with government policy decisions sending more and more people to homelessness services, and then no change in the resource capacity of homelessness services to respond. And at the same time, of course, the housing market is getting more and more difficult, and that is making it even more difficult for us to exit people from homelessness. So we're just responding to more and more people within homelessness, and workers are having to make those choices every day between breadth and intensity. So do we try and see more people but spend less time with each person, which means perhaps you can't you know, provide the depth of support that someone needs? Or do we leave people on waiting lists and spend more time individually with people, but know that, you know, you've got that weight of people who are not getting support? So it's not a fair situation for the sector and for workers to be in, to have to be making those choices. So I can see lots of comments coming through. I wonder, Deb, having heard Deb Batterham, having heard all of those reflections from peak bodies, and can see what's kind of coming through on the chat, what your reflections are about, you know, the most important strategies going forward.
Absolutely. Thanks, Kate. And just a brief pause as well to do a shout out to the team. So while I led the team in the research, it was very much a team effort with my co-authors who all did a fantastic job. In terms of things going forward, I suppose, and I won't move the slide around because everyone's using it, looking at it, but if I were to go back to the previous slide, we need to focus on the bigger parts of that triangle. We need to focus on reducing the risk and reducing exposure, and those responding to those issues and doing that work very much requires collaboration right across the specialist homelessness sector, and it involves collaboration across sectors to get that done. There's obviously advocacy work to be done. I think we're in a really excellent forum for talking about how we can, you know, work together across the sector to get some change here, because as you mentioned, Kate, I mean, as everyone has mentioned, really, current resourcing is not sufficient to do the work safely. And the setup of the whole current system, despite you know, good intentions in there, is harming workers. And it's not just it'd be great if things improved. Actually, it's a health and safety risk, and it has to improve. So how are we going to do it?
Beautiful. Thanks, Deb. And I mean, one of the great things about bringing together peak bodies is that each of the peak bodies in their own way, and Homelessness Australia at a national level, are already advocating for more resources for the sector and for more social housing, so that we have less people needing homelessness support and more opportunities to exit people into safe accommodation. So I can see that those elements are already present. I think, though, for me, what this research is a sort of further impetus to increase the intensity of that advocacy, because we can see what a terrible impact it's having on the workforce. I wonder, from my peak body colleagues, if you've had any reaction from government to the findings of this research, given that government is funding homelessness services, and the ways in which homelessness services are being funded are having these impacts on workers. You know, government has a large share of the responsibility for that, but I'm wondering what their reaction at a state level has been. Stephen, can I start with you?
Oh, thank you.
I
I'll-
could see you nodding.
Yeah, look, yeah, I've sort of contemplated on, yeah, let's put it this way. My phone's not ringing red hot with regards to let's discuss the trauma research. Look, I'll come back to the fact that we currently have measurement systems that don't necessarily capture this. How do you capture this as an output? How do you consider this as a value for money from a government end? We very much know we're talking to the converted here and far beyond that. This is a positive outcome for the workforce. We need to move government's mindset and lens into understanding that unfortunately not all money is going to be in an outward facing setting. We actually need to care for our workforce too. So I'd love to have conversations with our local state government and even federal, but yeah, currently that's not something that's taking up much time.
Thanks, Stephen. Dom or Deb, did you want to jump in?
Yeah, I'll jump in. The response from government, particularly elected government's been pretty lackluster, to be honest. You know, there's sort of was the recognition that the research had come out, but not really thinking in any way about the solutions that had been proffered. So that was disappointing, but not unexpected, to be frank, because we're amongst friends here. We can talk openly about what it's like to deal with elected representatives. From a public service side of things, though, there's been quite a bit of interest, particularly in health and wellbeing for the workforce, and looking at how we might be able to use some of the data from the report to really shape our industry and workforce development program work that's done in New South Wales. So that's a good sign. No extra funding on the table yet, except for that help with the wellbeing survey, which was very, very much appreciated. So more work to be done in New South Wales.
Thanks, Dom, and Deb, just finishing up with you.
We got some money from government initially to do the research piece, which was fantastic. But in terms of putting together the proposed solutions that we've all discussed and some money with that, haven't had any traction or luck. Obviously, we've put it in our pre-budget bid and we will hear in May. I would love to tell you that I'm quietly optimistic, but on this one, I'm not. But so if any of you end up getting traction or there's a particular campaign that's working, please share it with other peaks because we'd love to get some traction in this space. Thank you.
Thanks, Deb. Well, just to wrap up, one of the
Can I be rude, Kate?
yes, Deb.
Sorry, I was just going to make one suggestion that I think one important thing that this piece of research can do is highlight that the trauma that the workforce are experiencing gives you an occupational health and safety lens on the underfunding and under-resourcing of the sector. And so maybe there's, you know, scope for future discussions about whether services could collectively do something like a 2-week window of using their incident reporting systems to record some of the sorts of things that are happening in much more detail than they currently are, and taking that to government as evidence, as, you know, with health and safety having a range of legislative mechanisms that can mandate action.
Thanks, Deb. That's a great suggestion. So certainly from my perspective, one of the outcomes is that we need to be, you know, having this conversation with the ASU as well about how we can work together to support better funding and better processes so that we're reducing this workforce harm. And I think using as Deb suggested, using the outcomes of the research to inform the advocacy and continuing to investigate the extent to which workforce trauma is continuing or being ameliorated, or and raising that with government is important part of the next steps. From Homelessness Australia's perspective, one of the things on our agenda coming up is to really be putting an outcomes lens on government policy decisions that create homelessness. So looking at what the gaps in the overall systems are that are resulting in more people experiencing homelessness, whether that's inadequacy of income support or lack of access to social housing or lack of supports in other service systems. And also as I mentioned, continuing to work with the ASU, continuing to work with our state peak bodies, and also continuing to have a focus on workforce wellbeing in our events like the national conference and webinars like this. So this won't be the last time we talk about this issue, but I do very much appreciate we've come to time everyone's participation. It's been great to have so many people come and join the conversation today. Many thanks to Deb and the research team for doing the work, and many, many thanks to my fellow fabulous Homelessness Peak Bodies, Homelessness New South Wales, Homelessness Queensland and Council to Homeless Persons for sharing your insights today and for being part of the advocacy to achieve change. So thanks everyone for being involved, and we'll send out all of the materials and the recording so you can enjoy the event again at your leisure. Thanks, folks.